we've had plenty of media attention happening in our county in the last week and a half due to the rising number of cases and topping the highest case numbers that we had in 2020 and throughout the pandemic. In the past 7 days, we've seen 245 new cases, 560 in the past 14. Our 14-day case rate last year at this time was 129.9. That was the highest we'd seen thus far before we had started coming down between November and December. Last week we topped out at 143.7. This week we're at 121.3. Hoping to string together a few more days of less positive cases, but we just don't know. It was predicted that Minnesota and Northeast Minnesota would peak by end of October, and that didn't happen. We had a couple weeks of plateau and then just shot right back up. So hoping to see some reprieve. Our healthcare folks would certainly love to see some reprieve. They've been struggling, all of our healthcare facilities, with being on divert and not having enough critical care access. We're at 95 confirmed COVID deaths in Itasca. That's 24 deaths since September 12th. Last year, this week, when I was here talking to you, we had 24 deaths total. So we've had a really tough fall in Itasca. Average age of positive cases in the last 2 weeks is 38. Cases in school and pre-K 18 and under is at 23%. I actually spoke to the city of Grand Rapids last night, and there was a question on those numbers, and it's important to note that there's other viruses going around. There's strep, there's RSV, and so seeing 23% doesn't fully tell the story of what's actually happening within our schools right now. There are kids out for other reasons. Vaccines administered, we've had 23,821 Itasca residents complete their series. That's 55.9% of the population that has at least started their series. 5 and up are eligible to receive vaccines now, and 59% of that age group has received at least a first dose. Public Health has given 7,534 COVID doses throughout the pandemic. We do have some upcoming clinics happening. Moderna, Johnson & Johnson, you have the dates listed. December 1st is our next one for Moderna. December 7th, Johnson & Johnson. We will be over in Nashwauk offering both on December 9th. Registration for all of these clinics is on the Itasca County website under coronavirus. We're still offering flu vaccines. If you haven't received yours yet, call the Itasca Resource Center for an appointment. Community vaccinations, you will want to schedule ahead for availability. I had learned from a community member that there were a couple of pharmacies out of vaccines this last weekend, so just make sure that you're making sure they have them available. Pfizer, which is available for ages 5 and older, all of our clinics are offering it, and then Walmart and Thrifty White. Moderna, we have 4 pharmacies offering, and then Scenic Rivers and Public Health, and Public Health is offering the Johnson & Johnson. Delta remains the active variant in Itasca and Minnesota. There hasn't been another identified variant yet. Since Delta arrived, we certainly had other variants that were in Minnesota and Itasca prior to the Delta variant. Schools, they are in varying levels of mitigation. Some are full masking. Some have some classrooms that are moving to distance learning. It depends on what's happening in the classrooms and their buildings and their staffing situation. Vaccine breakthrough in Itasca, 3.4% of our fully vaccinated residents have tested positive for COVID. This is updated once per week by the Minnesota Department of Health. So that's 811 out of our 23,821 fully vaccinated folks. 54 of those were hospitalized, 9 passed away from COVID. Masking in public indoor spaces is still recommended to mitigate COVID, as well as vaccinations. Keeping your group small, staying 6 feet apart, all still recommended strongly to mitigate the spread. And again, our healthcare partners would really be thankful if we could slow the spread of COVID. Their critical care access, of course, isn't all related to COVID. No one has said that. the biggest piece is if someone is hospitalized with COVID, unfortunately, they tend to be hospitalized longer, require more healthcare resources, and so there's a bit of a bottleneck in moving patients through. And then there's rehab shortages because oftentimes after that type of hospitalization, you need rehab, and so there's just bottlenecks that they're seeing. Questions related to COVID, we continue to staff a COVID message line, 327-6784. Call for any questions you have related to COVID. If you need help registering for vaccines, if you need a homebound vaccine, we're still traveling throughout the county to offer vaccines, both influenza and COVID inside folks' homes.